Gaslighting was Merriam-Webster's word of the year, and our next guest experienced it firsthand in doctors' offices. Preslee Marshall joins us. She says she's been the victim of medical gaslighting. Good morning to you.
Good morning. How are you?
Very well, thank you. So it took a number of visits, a number of specialists before you were diagnosed with fibromyalgia. Tell us about how it finally got to that point.
So after being dismissed by so many medical professionals, I kind of realized that it was up to me to get the diagnosis that I needed. So I went to the doctor and basically demanded to get certain tests done, which would rule out other possibilities or rule in possibilities. And from those results from the MRI that I got, I was able to take that to a rheumatologist who finally diagnosed me with fibromyalgia after about 1.5 years of the pain that I was enduring.
And about 1.5 years of being told, well, it's all in your head.
Yeah, I even had a neurologist tell me that if I got my nails done, I'd feel better. And that was probably the worst of it.
And fibromyalgia is one of those odd ailments that, I mean, it presents differently in every person, and it presents sometimes symptoms that could be, like, as you say, it could be multiple sclerosis, it could be a number of other ailments as well. So, I mean, already there's a bit of confusion about fibromyalgia, and then add on top of this, well, you know what, it's probably, if you relax, you'll be fine.
Yeah, it was very frustrating because I knew the pains I was feeling were real, they were happening, and it just sucked that medical professionals who I was told to see if I saw changes in my body dismissed it immediately.
Because who knows your body better than you, right?
Right, yeah. I don't know. Getting my nails done just wasn't the cure for this one.
So now you're advocating for others to help spot medical gaslighting. What are some of the tips that you're giving other patients?
For sure. So one of the biggest ones that I think I hear of the most would be when a medical professional says it's all in your head. And that's actually one that I heard as well. If they immediately blame your symptoms on mental illness without further treatment, if they do think it is that, if they're rushing you, and if your symptoms are being downplayed, those are all signs to look out for that could indicate that you are being medically gaslighted.
So how did you actually push? What did you have to do to get the testing that you needed?
I ended up calling a walk-in clinic for it. This walk-in clinic was actually the first clinic that I ever called when I started experiencing my symptoms, and when the first time I called them, they just said, it's probably fibromyalgia, do Tai Chi. And I was confused because I've never heard of it before. So from there, I did my research about it. So later on, I ended up calling them back and saying, well, if you think it's fibromyalgia, I want the test done to prove it. And they kept saying, no, the neurologist will do it for you. All these specialists will do it for you. There's no point. But I knew that they wouldn't have. And if I didn't go back and demand that MRI, I might have not been diagnosed to this day.
Okay, Preslee, we're just about out of time here, but we're going to get your social media information up on our website at chch.com so that if anybody else feels that they are a victim of medical gaslighting, they can see your story as well. Thank you for joining us this morning.
Thank you so much.